Takeaway from today, and you can chat in your questions. There's a chat function there. There are other ways to bring folk in and to ask questions, and we'll save them till the end though. So takeaway, the fact is you really can improve your health, right? There is an incredible connection between the mind and the body, and I've worked in as an oncologist in the oncology world for over 25 years. I've been really fascinated by this question of what people can do to empower themselves and the remarkable cancer survivors, the people that do exceptionally well. And there seems to be some consistency in this. And it's been fascinating for me to be able to offer the science, the burgeoning science, the mind-body science has really taken off, especially in the last 10 years. And so what you know intuitively, your mind can influence your body is actually being proven from a scientific perspective. So I hope to offer this for you. And as well, we're in the midst of a COVID pandemic, and I want to offer you practical ways that you can maximize your immune function, decrease your risk of getting the virus, being able to recover more easily and get through your treatments or your lung cancer situation in a better way. So really, this is an empowerment piece. Part of it is that I want you to focus your intention on the things you can control. That's the fact that you're joining now is sending that meta message about I want to recover, I want to get well. And so I want to be you to kind of take your attention off the things you can't control and focus your attention on things you can control. And that's when one of the characteristics of the remarkable cancer survivors, the people that do exceptionally well, put their energy into what they can control, their attitudes, their actions, how they express their love and spirit in the world, how they find meaning in the day-to-day. So it's that kind of the energy of I want to live, I want to be part of this, I want to be connected. And when you get your mind in that space, it does have an influence on your body. So focus on what you can control. And the last thing is, and I've just seen it in just too many people, they worry about something happening, they won't be able to cope, their family won't be able to cope. But the fact is, there's something within you that gives you an incredible resilience, an ability to adapt to whatever situation you're facing, and that you can do way better than you expect at any point in time. So you can make a difference here. Okay, so what do I want to cover? Big picture, how you maximize your chance of recovery and longevity after a cancer diagnosis. I want to talk about setting your intention, choosing to be your best self, no matter what scenario you're in. And how do you do that? By creating the conditions of calm, by decreasing your stress levels so your immune function increases. And then, because we're human, there are going to be times when we're anxious and upset and frustrated and scared. So what do you do when you kind of get out of hand in those situations? I want to take you through some examples of how to reframe your difficult thoughts when the kind of catastrophizing mind starts to take over and cause you problems. And then lastly, I want to push you towards a kind of transcendent perspective, that kind of ability to watch yourself, the kind of observer consciousness that recognizes that there's more to this world than just what you see with your eyes. Okay, so how do I define the best of lung cancer care? Well, it's the integration of the best from the medical system with what you can do to empower yourself as level of body, mind, and spirit. It's the marriage of those two together that I think gives you the best chance of recovery. It starts with understanding what's happening, and that's why I'm really happy you're connected with Lung Cancer Canada, because you're getting the information, you're understanding your situation, you can begin to have a better conversation with the medical system, you can advocate for yourself. And then you also, around the COVID situation, you need to self-isolate, you need to wear a mask, you need to kind of stay away from other people in order to minimize the chance that you get the virus. So the point is that empowerment allows you to see what you can control and what you can't control, and then you focus on the things you can control, right? So it's information starting out with. Then the medical system. This is probably a 25-minute talk, 30-minute talk by itself, but it starts out with the attitude that you are the most important person in the system, right? That your health, Your happiness is what the medical system is there to try to provide for you, to serve you. And when you have that attitude, then you're willing to advocate for yourself. You're willing to make those extra phone calls. You're willing to prepare for your medical appointments. You're willing to, involve your friends and family to help you through the situation. You're willing to find out what the medical system can provide in terms of the extra services and so on. So you get the information and you advocate for yourself. You come prepared. And the fact is, and I just want to comment because I'm an oncologist, I'm in the medical system right now, and I know that we continue to treat people. The chemotherapies are going forward, the radiations are going forward. When the surgeries are necessary, they're going forward. So I really feel that we, as within the Canadian society at least, have done a really good job of flattening the curve. There's not a huge number of people in hospital now because of the pandemic, and therefore we have the resources to take care of everybody right now. And hats off to all the Canadians that have contributed to kind of self-isolation and the fact that we are, flattening this curve so that people with a cancer diagnosis get the treatment that they really need in a timely fashion. So things are going forward. So there's the medical side in some sense, and then we're going to talk about some of these things, the empowering the body, right? So what I've listed here is going to influence your health and happiness. There's the level of the mind, how you work with your mind, how you work with your stress levels, how you work with the thoughts that cause stress. And lastly, kind of seeing a bigger perspective. We're going to talk about that part in whatever way is best for you. So nurturing that bigger perspective, that greater meaning, the highest part of yourself. Okay, so that's how you maximize, how you get the best care and recover, longevity, so on. So I already kind of explained this idea of getting the information. Now the next slide is actually very important. It's the power of acceptance. So I first became interested in this issue in the 1980s when I read my first book called Love, Medicine, and Miracles by Dr. Bernie Siegel. And he was describing his, what he called exceptional cancer patients, the ones who did exceptionally well, who got through very difficult treatments much more easily, who far outlived their doctor's expectations, people who hadn't got a spontaneous remission. And he recognized that there were certain attitudes and attributes of these remarkable survivors. And I've followed the same story. Dr. Alistair Cunningham was at Princess Margaret Hospice, Sunnybrook, the Healing Journey program. So he actually studied it kind of prospectively, scientifically. Recently, there was radical remissions. Kelly Turner interviewing dozens and dozens of people who undergone spontaneous remission. This is one of the key kind of attributes, and it's the attribute of acceptance, accepting the truth of what's happening in the moment. And when I talk about acceptance, I'm not talking about resignation or giving up or abdicating your responsibility. Acceptance is this ability to see the truth for what it is as your starting point and being able to accept that and then grow from that, right? So instead of, so the opposite would be to say, this shouldn't be happening, this is totally unfair, and kind of struggling with the truth of the situation. So the truth of the situation is, you have a lung cancer diagnosis, there's a COVID epidemic, and you have a certain emotional energy right now. And to fight against the reaction of any one of those is to create an extra layer of stress and suffering. Instead, starting afresh, always coming back home to the here and now to say, let's take this one step at a time. What can I do to influence my health and happiness, and going forward from there? So it's both a kind of letting go of things we can't control, and a proactivity. It's a middle ground. It's an and both phenomenon. So that's a first attribute, just be able to say, okay, well, this is the truth. Let's work from here. Okay, so one of the most important things you can do is to set your intention, to choose how you want to be in this world. And I think, because it's one of the very, very powerful ways that changes the chemistry within your brain, which influences your body. But essentially, you can choose to be your best self. And, you guys can chat if you want to. What are the attributes of how you want to be? What do you want more of in your life? What do you want to manifest more of in your life? So you might think, I want to be more peaceful and calm. I want to be maybe more patient. I want to be maybe more empathetic, compassionate. Could be more grateful. Could be more joyful. You know, there are different emotional states, and you can decide what's most important for you, but to be conscious of it. And when you practice those states of mind, whether being centered, calm, clear, confident, whatever it is, your brain gets better and better and better at doing it. You kind of reset the wiring within your brain to get stronger and stronger and stronger at being in that state of mind. Because otherwise, the winds of the world will blow you this way and that, and you'll react and you get pushed this way and you'll be kind of blown all over the place. So you can actually center and decide, okay, well, I am going to be more peaceful and so on. But it takes a conscious setting of the intention. And I do it in 3 ways. One is to actually have a ritual or a practice in which you say to yourself, okay, well, I want to be this way in this situation, more peaceful, for instance. And so in my morning meditation, I practice mindfulness to start out with, and I'll give you a bit more of an example of the mindfulness piece here. At the end of that, I put my hands kind of up in the air, and it's like I'm receiving kind of higher guidance, kind of a download to say, well, how do I want to be? How is it that I can bring my love and wisdom and kindness and my best self into the world? What do I value? What do I want to do? And so I'm kind of praying, and sometimes I use religious terms. Mostly it's kind of a secular type of prayer. Let this be so. Let me be an instrument of love and peace. So I'm kind of saying my prayer really, really hard. And then the last thing I do is a kind of ritual. I kind of bow my head, put my hands up, and it's kind of like submitting to life. I can't control everything. All I can do is control my perception and how I respond to the situation. So the ritual can happen like first thing in the morning, maybe just before you go to bed, kind of setting the gratitude. You can also set your intention going into a difficult situation, right? So you're going in for your medical appointment, for instance. And just as you're kind of coming into the hospital, or just as you're sitting in that clinic room waiting for your physician to show up, you're going to say to yourself, okay, I'm setting my intention now to stay grounded and clear thinking. I'm going to advocate for myself. I'm going to be peaceful and as calm as I can be in the circumstance, right? So it's stressful. It's stressful to be chatting with your physician and not know how that conversation is going to go. And so you recognize that, okay, I'm going to feel a little bit upset, but I am going to decide to be more centered and peaceful, and I'm going to really focus my mind. So you're choosing, or maybe you're going into a difficult conversation with a friend or family member. You're choosing to say, this is what I want to bring into that situation. And then the third one, which is actually the most difficult, obviously, is when we really get stressed and flustered and really upset. Sometimes you remember, oh, I'm really stressed. What do I want of myself? What's my best self? How can I bring my best self into this situation? And so you kind of come home in the moment. It's kind of setting your intention in the moment. Say, okay, well, let's remember what's most important. Let me bring my love and my wonderful spirit into the situation, right? So 3 ways to decide how you want to focus your spirit and energy. So it's the proactivity piece that I'm pushing you towards. And you can do that at any point, right? So no matter what situation is, you can always focus more. And you're not going to do it perfectly. We kind of let go of kind of being perfect or zen all the time, but just bring more love and spirit and your best self into the situation. Okay, I want to explain the hand model of the brain. Through evolution, if the wrist was the spinal cord, the base of the thumb is the reptilian part of the brain. It's a fight or flight, this kind of pure stress reaction. You're walking down the sidewalk, a car is coming up over the curb to hit you. That part of your brain gets you to jump out of the way of the car before you can even think. So it's like, this is the stress center. It's the withdraw from danger center. The next part is the thumb itself. The rest of the thumb is the limbic system, which is the approach system. It's also what I call the stressed and irritable brain. It's more mammalian. It's complex, but it's kind of more of an emotional energy. So limbic brain, I call that the stressed, irritable part of the brain. And lastly, through evolution, the human species grew a lot of machinery in the frontal lobe. And that's where your wise and compassionate brain is. So you want to live out of your frontal lobe more often. And what happens to all of us, we kind of go back and forth throughout the day. Sometimes we're calm, we're clear, we're peaceful, and we're living out of our frontal brain, and you're happy yourself. Sometimes we get flustered and upset and scared and stressed, and that's the irritable stress brain. We go back and forth. And part of this talk now is to try to keep you in your wise, compassionate brain and not to flip your lid so often, right? So back and forth. When you're living here, your immune function is better. When you're living here, you're happier. When you're living here, your body's stronger. So how can we live out of this part of the brain? How can we engage this as what's controlling our actions, or the majority of our actions? So first of all, it's normal to feel anxious. It's expected. When you have the unknowns of a lung cancer diagnosis, unknowns of COVID, you're going to feel anxious at sometimes. But even then, you will adapt. You will let out the difficult emotions, and you'll come back. You'll have moments where you're living out of your wise brain. The other thing I'd say is, the irritable brain, stressed irritable brain, has its function to have you join the seminar so that you can take care of yourself and learn and advocate for yourself and figure out what's happening in COVID and make a decision about what you want to do. So you can do that. You can choose to do that more often. So I said that already. Okay. So if the idea is that you want the frontal lobe machinery to work more often and better, you can create the conditions in which this is more likely to happen. Kind of think about it. You have machinery in your frontal lobe here. How do you make sure this works best? In the same way, how do you make sure your car functions best? Right? So if you have a car, you want to make sure there's oil in it, you make sure it's gas in it, you maintain it. If there's a problem, you take care of it. In the same way, you can set the conditions in which you're much more likely to be living out of your frontal lobe. Okay. And when you do that, you're happier, etc. So number one, and it's a little bit harder to do in your apartment or your home, but it's super important to exercise in some way or form. And the exercise here is to get your heart rate up, a slightly shorter breath. And you can do that, 25 different ways, including watching a dance video on YouTube and kind of dancing to it in the kitchen, or going for a power walk, or following a qigong session at home. There's lots of different ways to kind of get your heart going. Join a video conference class so you make it more social. When the COVID's over, you'll be able to get out and do this in a more social circumstance, so on. When you exercise, you actually grow more tissue in your left frontal lobe. Exercise releases the happy hormones. It actually boosts the immune system a little bit. And I also think of it as releasing. It helps you to release the retained stress within your body. So we animals, when we're feeling stress, we hold on to it. When the deer escapes the pack of wolves and kind of gets to the safety and is kind of in the meadow by themselves again, they'll actually shake their bones, kind of shake out the stress that they've been under. And we humans don't usually do that because we think it's kind of, socially not acceptable. But you can kind of let out the kind of stress of your system. It's like expressing the emotions that are happening through a physical activity and shaking the bones. Okay, so exercise, it's super helpful for all the above in terms of happiness and capacity to get through treatment and so on. Next is diet. Diet, super important. You may have a bit more time right now to actually do your reading, figure out what makes sense to you scientifically, call the dietitian at the cancer center, get some feedback, et cetera, et cetera. But the the science is pretty darn strong that your diet has a profound influence. And there's a whole science of your gut and all the trillions of bacteria in your gut. They're in kind of a community with the rest of your body, and you want to feed those bacteria the kind of good food, which is essentially plant-based, right? Plant-based also kind of opens up the blood vessels and allows the healing of whatever tissues, any treatments you've been through. Secondly, the idea is anti-inflammatory, right? So what we don't want is the food that irritates the gut and irritates the rest of the system. It's kind of causing a kind of stress on the tissue, and it releases the molecules. Those molecules go up to your brain and say that you're tired. So we know that inflammation causes fatigue. Inflammation causes the blood vessels to shut down. Inflammation decreases your ability, your immune function. So definitely anti-inflammatory is so key in terms of all aspects of your diet. Second thing is something called low glycemic, which means the blood sugar levels come at a very smooth level. They don't kind of have the big peaks and the big drops back and forth. The issue around the blood sugar is when your blood sugar goes too low, well, actually, like think of drinking a pop or soda, whatever. It's like that much sugar, right? You drink that, you get a big spike in the blood sugar, and that by itself causes the brain not to work very well. But then the system tries to get the sugar into the cells and out of the bloodstream. And that releases a whole bunch of other chemicals, including like insulin-like growth factor, which actually prime cancer cells to grow. And you don't want the kind of priming. What you want is a nice, smooth glucose blood sugar level. Other thing is when your blood sugar goes way down, then you flip your lid. Essentially, the frontal lobe takes up too much energy in terms of sugar. And if you have a low blood sugar, it flips and you get working out of your irritable stress brain. And that's the part of your brain that wants to like go find some cookies. You know, it's that type of issue. So the idea is to eat more complex carbohydrates, stay away from the sugary processed foods, eat some protein with your meals because it slows down the absorptions of the sugar. So that's the kind of third component. Lastly, obviously, you want some brain food. We were doing a podcast yesterday. We were talking about mushrooms. Mushrooms actually help the brain kind of relax a bit more. I'm not talking about magic mushrooms or any type of drugs, but just like regular food, help the brain be in a more positive space. So you want the brain food. You want the omega-3s. You want the healthy fats that feed the brain, right? You're feeding this hardware, this machinery in your frontal lobe. And so you do that through healthy brain food. So again, what we're working at here is having you in your positive self through your diet. Sleeping, and yes, it's harder to do during kind of pandemic conditions, but there are ways to facilitate a good night's sleep or create the conditions in which a good night's sleep is likely to happen. And we call it sleep hygiene. And it reminds me, one of the things you can do is to turn off your devices, turn off the screen and all this kind of blue light that's irritating your brain and keeping you awake. And especially turn off the kind of television news and the distressing images, right? So stop kind of scaring yourself in some sense. Again, it's a longer talk around sleep hygiene, but essentially routine, staying in the dark, trying to get up at the same time, getting some bright light for the first hour in the day. In the middle of the night, try to stay in the dark. And so it's something that you can do your research. You may have some time now to say, what are the things I can do to kind of change my sleep patterns into a more positive system? The last one is I do agree with napping before 5 p.m. 15, 20 minutes a day. It does decrease the kind of stress levels, the blood sugars, the blood pressure. Your brain actually learns a little bit better after a nap as well. So again, it's something, the other kind of takeaway in this situation in terms of COVID, getting yourself into a routine, right? So that you're getting up at the same time, you're exercising at the same time, you're doing the same routine, going to sleep. It helps your brain and decreases the kind of anxiety levels because your brain gets used to that new routine. So lastly, super important, this one, you really do influence your immune function, right? We all have a kind of certain level of stress. It's what I call the stressometer. What level do you live at? Are you kind of in this kind of more anxious state most of the time? Or in this more calm, more peaceful, more centered state most of the time? And so you can reset your stressometer by practicing relaxation. And I classically think about that as meditation. But it, it could be like doing a qigong or a tai chi. It could be like lying back and doing a body scan, listening to a guided meditation, doing a walking meditation. It's every one of those activities. It's not just about relaxing. It's not like taking a bath or going for a walk in nature, which has its place. There's nothing wrong with those things. But it's the skill of being able to recognize, oh, I'm starting to think or catastrophize, in bringing your attention back, right? So when you're doing, qigong or doing a meditation, the yakking mind is going to come up, right? The thoughts are going to happen. This is what the brain does. The thoughts are going to happen. When you recognize it, you bring your attention back. And it's the muscle of bringing your attention back to the here and now, which is where your resilience is, that gets stronger and stronger and stronger, and you reset your stressometer to a more relaxed phase. Now, the outside world is going to present you with the same challenges. It's not that that really changes, but when you're in that more relaxed, centered, positive state of mind, you're able to respond in a way that's healthier and better for you, and you'll be happier. And as I say, the immune function is so much better on that side. Okay, lastly, we humans are very physical. We're very tribal. And even if you can't get a hug from somebody else, even to self-soothe, right? To kind of rub your skin or your cheeks or your head, or doing those things actually does settle down the nervous system. So you create the conditions. Going for that warm bath or that warm shower settles down those kind of sensations, those pathways. Yes, do the things that nourish your soul. Look for those opportunities. Can you get into nature? Can you connect with your loved ones in a way that opens your heart, the kind of connection piece? Can you learn a new hobby that makes you happy? Okay, so it's not just creating conditions for calm, but avoiding the stuff that's stressing you unnecessarily. And I think of that as television news. I personally, I can't watch television news. It's too distressing for my kind of sensitive personality. So what I do is I listen to CBC radio almost every night right now, but it keeps me in touch with what's actually happening. I'm getting the information without the kind of stress reaction, the kind of smack over the head. So other one is, you might want to really take care of yourself and really eliminate the unnecessary drama in your life. Obviously, too much social media, that kind of scrolling through lots of pictures and too much stuff, and especially the kind of the negative stuff. But even the kind of, the cat videos can get too much, unless that, mirror neurons as well. So not too much of that. I like social media. I should say I like social media for when you can connect with others, when it's a mechanism of, a human-to-human connection. I think that's really very powerful as well. Obviously, you're avoiding the stuff that's causing stimulation. Okay, so far what I've said is you can practice certain lifestyle habits that get you back into your frontal lobe more often, and you can reset your stressometer. Life is still going to happen though, right? Things are still going to be irritating. People are still going to be people. You're still going to be working with a lung cancer diagnosis. So the anxieties are going to come up at times. It's normal. It's natural. This is not about trying to put on a happy face. It's like being human and authentic and working with what's there. So have a plan. If you notice that you can really get yourself hyped up and stressed, think about it beforehand. What's worked in the past for you to kind of settle yourself down again? Do you need to practice a breathing technique? Do you need to talk yourself down? Do you need to practice one of these other techniques? But think about it beforehand so that you'll be prepared in the midst of it to say, oh, now I'm really flustered. Let's work on this breathing technique. I'm going to take you through a 4-step process. But one of the most powerful things is to let go of the catastrophizing mind and bring your attention into the sensations and being able to watch your thoughts. It's kind of the observer consciousness of what's happening here. Sensations of body, observation of thoughts. As soon as you do that, you're almost into a different level and starting the relaxation process. If you can't talk yourself down, there's a breathing technique I'm about to teach you. Pretend that you're relaxed. This is a wild one. So it's what I call a body up technique, meaning we often think of our minds and thoughts influence how our body feels, but it actually goes the reverse direction. If your body is relaxed, it sends a signal to your mind to say, I'm relaxed, I'm safe. So for instance, one of the ways to kind of settle yourself down when you're too stressed is to actually slump back in your chair, kind of almost like you're having a nap, and pretend you're chewing. And that kind of feeling gets sent up to the mind to say, I'm actually relaxed. Because you would not be adopting that posture if you were truly in threat. So it's one way to kind of trick the system. I said before, self-soothe through touch. Again, it's bypassing the normal processes to say I'm safe and so on. The skin actually has some nervous endings that pick up speeds of less than 2 miles per hour. So we're wired to pick up this kind of self-soothing sensation, right? I'm with my mate, I'm safe with my tribe is the kind of message that gets sent up through the smooth soothing. Remember what it's like to feel good, right? So if you're going into like a medical appointment, you can think to yourself, oh, I remember what it's gonna be like when I actually leave the medical appointment. I'm going home and I'm having supper tonight. Oh, I'll feel much better then. Right. I'm wondering if we do want to. Do you want to have Julie ask her question, Christina, or do you want to? You guys can moderate that. You can interrupt me if you want Julie to ask her question at this point. All right. So remember what it's like to feel good. So you're going into your medical appointment, and you're scared at that point in time, but you remember, oh, I remember what it's like to feel good going back home again, having supper tonight, and that can actually settle yourself down. Last one is, I think it's super important to have one person in your life who is the wise listener, somebody who does not have to correct or give you advice, whose simple presence can settle you down. And you might set that up by actually going into the conversation, preface the conversation with, I don't want you to tell me what to do or give me advice. I just want you to listen to me. I'm just going to let you know how I feel right now. And so you're telling the listener, you're telling your friend, you're telling your partner, this is their role in the situation. And sometimes just labeling it, I'm feeling scared, I'm feeling upset, I'm feeling angry, I'm feeling flustered. It's like, again, you're kind of bumping yourself up into a bigger level of consciousness when you can observe yourself, observe the story of your life. Okay, so this is one of the techniques I found very helpful is when you do recognize, you're scared, you're flustered, you're upset, is to actually press the pause button on the situation. Meaning that, almost all the time, you don't have to snatch the child from underneath the car. You actually have some time to settle yourself down before you decide what you want to do. And so you physically, literally pressing the pause, let go of the catastrophizing mind. The problem is that things are scaring you, right? You're causing this kind of stress reaction, all the things, the bad things that could be happening, and it's scaring you into the rest of the body. You need to let go of the source of this, pressing the pause button, becoming very curious about the physical sensations within your body. So in fact, you guys can do this with me now as I'm explaining this. When you become very curious of the physical sensations, right now I want you to take 4 slow breaths into your abdomen, deep abdomen. And watch what that feels like right now. What is it? What sensations are you experiencing? Without labeling it, just experience that. And a nice, slow, smooth, long out breath. And then that sends a signal up to your brain, and then you can reassure yourself, I can get through this. Let's take this one step at a time, right? So you can see the steps there. I want you to take through I want to go quickly through the last part of this, which is getting to the source of why you're feeling stressed, upset, or scared. And it's based on cognitive behavior therapy and David Burden's book of about 40, 50 years now. The first idea is that it's the thoughts and core beliefs that influence the emotions. So if you think to yourself, I'm no good, I'm a loser, blah, 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 that leads to depression. If you could reframe the core belief with something that's wise and true and positive, something like each person has the intrinsic beauty and peace. Each person has their intrinsic beauty and strength, right? So when you understand that, which is actually true, it's a truth by itself, when you reframe your thought, that often leads to the depression being less severe, right? So looking at the thoughts. The point is you can change your core beliefs. It's kind of like a virtual reality that we create for ourselves and the thought patterns. And so that changes your perception of self, other, in the world. And ultimately that leads to you feeling stronger, happier, better attitude, productivity. It's your best self, right? You can bring your best self into the world. So I want to go through a couple of examples using this 3-step technique. You can see the situation is up top. Becoming mindful of distressing thoughts is the left column. The middle column is how to work with those thoughts. And lastly, what we really want to get through is the wise and compassionate response. And that's by acknowledging, being creative and looking at a bigger perspective and being encouraging of yourself. But really it's a self-compassionate perspective. Okay, you're in the midst of COVID, you're on chemotherapy, and you're feeling tired and raw. That situation up top is just the truth of the situation. There's no judgment. This is what happens to people. But on top of that situation, which has inherent difficulties, you have an extra thought that causes you extra suffering. And what we're trying to do is to let go of the extra unnecessary suffering. And the thought could come in, I'm all alone in this. I don't have the strength to get through it. It's no use, right? So you can just hear the quality of my voice. If you can hear that, then you can actually start to reframe it. So what emotions fall that way of thinking? So if you said that to yourself, you would feel more depressed, down, despair, causes less energy in your body. You're draining yourself of your strength. Is it helpful or harmful? This is actually a harmful thought, right? Lastly, which is the kind of logical part of this, like a lawyer arguing in a court of law, how is this thought exaggerated? I'm all alone? Is that true? You have nobody in the whole world that you reach out to, including somebody within the medical system? You don't have the strength to get through this? Well, in this situation, you are kind of getting through it, and it's no use. Well, the doctors are giving you chemotherapy, so therefore they must be trying to increase your longevity or chance of cure. So therefore, there can be some use. So again, you can see that exaggerated thought. And so we look to a kind and rational response. So acknowledge, look to a bigger situation, and be encouraging. And we did a slightly different reframe on this. So I'm just going to read this one. Who says you always have to feel strong and try to keep it together? Sometimes to cry and fall apart is the best thing to do. Then it seems to find an inner strength or a higher power. It's right, like let go and focus your energy on what's happening right now. And it's almost as if you're being buoyed by this. And then you can also take the practical things. Well, let's just take this an hour at a time, or maybe I can have a nap now and I'll probably feel better tomorrow. Or I can reach out right? So you start to think of the practical ways instead of talking to yourself like it's no use. You say, well, I can make the best of this. Okay. You have a cancer diagnosis and you're self-isolating, right? So that's the situation for almost everybody who's on this call right now. So that's the truth. And then on top of that, can you be mindful? Can you pick up the thought? This is BS. I'm stuck inside and can't do anything. My life is wasting away during COVID. This is totally unfair, right? And so there can be some kind of underlying truth, the kind of mourning, seeing some of the limitation here, and you can mourn that. But when you exaggerate and when you really focus on, you know, the negative aspect of this, then it's going to deplete you and it's not going to be helpful. So let's take it through the second column so you can hear yourself swearing in your mind or these kind of black and white type of thinking, then you can work through the column. What emotions follow. So this is the frustration and anger causing a stress reaction. It's not helpful. It's in fact harmful when you have the stress reaction. How is it exaggerated? Well, when you talk to yourself and say, I can't do anything, is that true? Can you not, you know, reach out to friends? Can you not learn something new? Can you not empower yourself? My life is wasting away. Well, you can also experience your life and let your love and peace into this world, right? This is totally unfair. Well, it is unfair, but you know, this is the situation and we can work with it, right? So you're using your higher wisdom kind of in the second part. Then finally, the reframe is on the right side. So we acknowledge, we look in a bigger perspective, and we're encouraging of ourselves. So how does that come out? Right? Yeah, this is tough, right? This is frustrating. So you acknowledge that it is difficult. It doesn't help to focus on the limitations, which is just wise. I can do things that fulfill me, right? So you can look for opportunities to really feel engaged in the world. This is a chance to focus on good things and to love, right? So again, it's the choice piece that enervates the body and gives the body that kind of extra energy. Okay, third example, I think I talked about this a little bit beforehand, watching the news of the pandemic, right? So you're binge watching the news conferences in Canada and America. So that's what's happening. And then on top of that, you have this thought, this is too much. All this stress is depleting my immune system. I'm going to get the virus and they won't treat me because I have cancer, right? So you kind of catastrophize how your kind of mind can go there. Well, what emotions follow that way of thinking? Well, you feel frustrated and stressed and upset. And that causes a stress reaction and your body feels more tired. It's not helpful to catastrophize. We're going to figure this out. How is it exaggerated? When you say it's too much, you know, you'd say this is a lot, this is a difficult situation, but to say it's too much, I don't agree with you. You have the resilience and strength to get through this. So I disagree with that sentence automatically. All the stress is depleting my immune system. Well, there's some truth to that one. So you do want to kind of keep yourself on the more positive side and not stress yourself. I'm going to get the virus. That's a fortune teller error. They won't treat me. Well, actually, in Canada right now, that's not true. They will treat you. They will take care of you, regardless of whether you have a diagnosis. So how do you reframe this? So you acknowledge, looking from your perspective, and encourage yourself. So how does that come out? It makes sense that I would feel stressed, right? So you're recognizing your common humanity. You don't have to beat yourself up for thinking, oh, I'm feeling stressed. It doesn't help to catastrophize, which is the kind of logical part of your brain. Like, it doesn't help for me to go in that space. So let's not go there. I can take care of myself. So you're listening to this talk. I've given you some ideas as to how to maximize your immune function. I can empower my body and I can make the best of it, right? Again, you're choosing where you can have an influence, how you can express your spirit in the world. Okay, lastly, and we don't have a whole bunch of time to go through this, but when you look at your fears directly, it takes the power out of them. And when you look at your fears directly, it releases life energy. You recognize that your life is precious. I'm not going to let my mind go into the kind of fear stuff, and I'm going to choose to live my life. So you're saying, okay, well, the fear is there. Life is precious. Therefore, I'm going to live my life fully as best I can, given the circumstances. and just to recognize and be compassionate and kind to yourself during this time, to recognize this is an opportunity to grow and to learn and to love and to give. And that's the transcendence piece around it. I think I'm going to write a whole blog on kind of the fear piece, because you can look at the different fears, fear of being dependent on others, fear of loss of control, fear of the unknown. There's lots of different fears that you can have. And when you look at each of them in turn, you can actually be reflective to recognize you do actually have capacity to learn from those fears and get stronger from your situation. Okay, a shameless plug for our book. You can see the website close to the bottom. It's called healingandcancer.org. The book is the teachings from an entire weekend retreat. So the kind of body, mind, spirit that I've been talking about, as well as every second chapter is a story of a remarkable person who attended the retreat. So a lot of incredible stories in our book as well. So $20, we can courier that to you. All right, guys. So I think we're going to stop there, and I'm going to hand it over to the wonderful leadership at Lung Cancer Canada, and they can feed me some questions if that's what you guys want to do. In fact, you guys could type in your questions as well if you want, if you have chat questions. Okay, so someone asked what my specialty is. So I'm an oncologist, and maybe I should have introduced myself. That helps, eh? So I'm a radiation oncologist here in Halifax. I specialize in breast, prostate, and pediatric cancers. But because lung cancer is common, I've treated lots of people who had a lung cancer diagnosis over the decades. And I also run a charity called healingandcancer.org. And I've been really, my life passion is to figure out how to empower people, how to, give them the tools and attitude and perspective that can really make a difference in their lives. And again, hats off to you guys for coming to the presentation.
Dr. Redlich, it's Christina. Thank you so much for giving us such an insightful talk. I think there's been many questions that actually have been coming in, and just a couple of things. One of them is, you mentioned something called walking meditation. Can you explain what that is? We've heard about meditation, but walking meditation seems like a new term to us. And
yes,
maybe give an example or demonstrate what that would mean.
Yeah, I wish I could demonstrate in the office here, but so the idea is during meditation is to focus your mind on activity. And typically, I'll share with you my own meditation experience. So I wake up in the morning, I've been meditating for about 20 years, and my wife and I sit down on these mats in one room, and I kneel on the mats, and I bring my attention to my breathing. Focus my attention, just the sensation of breathing. And within about 2 seconds of starting that, I'm starting to think about what I need to do that day. I'm planning for the day, have to give a talk to Lung Cancer Canada, are my slides ready? And I recognize that I'm thinking and not paying my attention to my breathing. So I bring my attention back to my breathing again. Within like 3 seconds of that, I'm thinking about what happened yesterday. I called my boss at home. I needed advice on this one case. I wonder if I should have done that. Am I sucking up to him? So I'm starting to think about what happened yesterday. At some point in time, I recognize I'm thinking about yesterday, and I bring my attention back to my breathing. And then I'm off again. I'm thinking about something else, and I'm bringing my attention back, and I'm, thinking about something else. And that's been a very similar experience for about 20 years right now. It's the bringing the attention back. It's like being able to watch that I'm thinking about something else and bring my attention back. And we know that people who meditate actually innervate the left prefrontal lobe. People who meditate have a better reaction to the flu vaccine, so their immune systems work better. They're happier, they're more creative, their moods are more positive. In fact, it's the left prefrontal lobe is associated with the positive emotion, the right side with negative emotion. And so you kind of build up the the machinery. It also sits over top of your, stress, the irritable brain. It's what they call dampens down those emotions. So paying attentions, emotional regulation, and kind of positive affect are the three kind of benefits of meditation. Now, the question was, how do you do that through a walking meditation? Well, you do the same thing. You walk extremely slowly and watch the sensations of walking, right? So lifting your foot slowly, heel comes off and toe comes off, slowly moving your foot forward, the heel touches, it rolls down onto your toes, and you're watching yourself walk and breathe at the same time. And as you slowly do that walking, the same experience is going to happen. The thinking is going to happen. Bring your attention back into your body. The other part of this is called introspection, your ability to watch the sensations within your body. And that's also associated with positive emotion. And it's how you let go of the catastrophizing mind. Anyways, that was a long answer, but you can do walking meditation.
Okay. Thank you. I think one of the next questions that's come in, I think, is a fear that, and a question that many of our participants have, and it's that, how do you get over the fear and deal with the stress of having your cancer treatments canceled until further notice?
Right.
The oncologist think it's not worth taking the chance of going to the hospital and getting the virus, but it's that balance between safety and
right. Yeah. And I should have addressed that one more directly during the talk. So it's such a great question. So it's obviously a balancing act, and that what you want is your health and happiness in the long term, right? It's the long term as possible. And so we're trying to balance those two together. What I can assure you is that if you were like having symptoms or, things were getting worse for you, the physicians would jump in and do that operation or start that chemo or start that radiation. So, the system is still running in terms of that side. But I also acknowledge that natural fear is going to come up. Is this delay going to actually decrease my longevity or decrease my chance of cure? And so to make that extra phone call, to call the hospital, to chat with the nurse, to chat with the oncologist, to discuss that, to get the reassurance that you're making the right decision. But it does kind of go back to the first idea of acceptance. The point is, we have to accept that this is the truth of the situation, and the physicians with you are trying to make the best decisions around what are the benefits versus what are the risks to having the treatment. I'm not sure if that really helps, other than to have a really good conversation with your oncologist.
So really, what you're saying is communication is key, and you're encouraging our listeners to really have that open and honest conversation.
Yep, excellent. Yeah. It's tough too. I'm not trying to minimize, I'm not trying to gloss this over that these are easy things to do, but when you practice the techniques, when you focus your intention on what you can do, you will feel better, and it will allow your body to get through whatever treatment you are going to have, if you're going to have it.
As a follow-up to that, some of our viewers are really hesitant to bother their medical oncologist, to talk to their medical oncologist and their medical team. Do you have any suggestions on that? They feel like the oncologist is not so open to talking.
Well, yeah, each oncologist has their own personality, and ultimately you want to get the best care from that oncologist, or get another oncologist if you can't kind of communicate. But what I can say is that a lot of the kind of well follow-up appointments have been canceled. And so the oncologists actually have some extra time right now. And frankly, you are the most important person. And if you're having anxiety, if you're having these questions, make that phone call, get the oncologist to call you back. Even a 5-minute conversation from their side may really put your mind at ease, right? And so remember, they're there to serve you. And we're so worried about those overworked oncologists that we're trying to protect them. Well, actually, because the well follow-ups are canceled now, they've got a bit more time. So please reach out if you need your questions answered.
I want to also at this point just let people know if there's any people that want to ask your question directly, please just raise your hand and we'll unmute your mic at that time.
Or you can type in a question in the chat box as well as another opportunity.
If not, then I can continue to do proxy. And, you know, so Dr. Rutledge, one of the questions is that on the stressometer, sometimes the stressometer seems really all the way up there, and it's broken the meter.
Yeah.
And so how do you use these techniques to come back down when it is such an anxious or stressful situation?
Yeah, and first of all, to recognize that we're not going to be in that peaceful state all the time, right? When did you not have a day when you're feeling good some hours, bad other hours, or good days, bad days, good weeks, bad weeks? Like there's kind of a ebb and flow that happens here, and so the takeaway is that you're not going to be in Zen state all the time. The techniques that I'm talking about, especially when you're really wound up, really upset, I think you need to practice it, right? You need to kind of focus on your breathing, the very long, slow, smooth out breath. You guys can actually do this with me right now. So very long, slow, smooth out breath. And then take a slightly deeper in breath. Another nice, long, slow, smooth out breath. And when you really focus your attention on that, that will give you some degree of relaxation. You might only go from like 100% stress to 80% stress, but at least you recognize that you're having an influence on how you're feeling. And as you practice that technique, you will get better and better and better. And so just keep on practicing. Keep reading, and as you practice a meditation technique or some type of technique in the morning or at night, it'll be easier when you get into that kind of super stress state to remember to tap into the new neurocircuitry that's been wired into your system. So again, it is an empowerment piece. It does take practice. You're not going to be perfect at it. You just want to feel better, get a little bit stronger.
Okay, so it is coming up to 2 o'clock now, and I know that if there's any questions that we have not answered today and you'd still like to ask, please email Lung Cancer Canada and we'll ensure that these questions are answered. Thank you so much, Dr. Rutledge, and thank you so much for joining us today. It is a very difficult time for everybody, and we will get through it. We do have if you need some help, please reach out to Lung Cancer Canada. We will help connect you to resources, whether or not this is COVID related or not. This is the second one of our webinars. If you missed our first webinar, which was COVID-19 and lung cancer, what Canadians need to know, it will be posted tomorrow. We, as you can see on the slide here, we have a new section called Ask LCC, which will draw all the questions that we have been getting about COVID-19 and into one resource. And I thank our medical student volunteers who are helping us with that. If you have any questions, please email them to asklcc@lungcancercanada.ca. We have been tracking, as we know that mental health and anxiety have been really top of mind for a lot of our patients. So we've been putting out a patient and caregiver anxiety and COVID-19 survey, and we really want to hear from you. The next survey will be fielded next week. There's a special Lung Cancer Voices special edition podcast that we also have, and you can listen to that on Spotify or any of your favorite podcast channels. But lastly, if you want to reach out, need a voice or a virtual hug, then please reach out to Lung Cancer Canada, and we would love to hear from you. So in conclusion, I do want to thank Dr. Rutledge for taking the time today and speaking to us about the very important topic. And I want to thank all of you for joining us again in the second of our webinars. Thank you. So
Bless everybody.
stay well, everyone, and take care.